I got a call this week about a dog bite, and the family had no idea what to do. So I thought I'd give you guys a quick update on what to do if you get bitten by a dog. Primarily, the dog bite victim needs to be taken to a safe place, away from the assailant dog, to prevent any further attack and injury. Since dog bites can cause significant damage beneath the skin, a type of injury that cannot always be easily appreciated, possible medical care should be accessed by a healthcare practitioner. Wounds should be kept elevated, and, if possible, washing the wound immediately with tap water should be attempted. Information should be obtained from the dog's owner about the dog's rabies immunization status immediately. Rabies therapy, if necessary, must begin as soon as possible. Also, the victim's tetanus shot needs to be current. Medical care should be accessed if the dog bite disrupts the skin, causing a puncture, laceration, or a tear. And if the skin is not disturbed, or if there's minimal abrasion present, it may be reasonable to watch for signs of infection, pain, redness, warmth, swelling, and drainage of pus or fluid before seeking medical care. However, infants and children should always be evaluated after any dog bite. There are important treatment issues that need to be addressed with the dog bite, primarily skin and tissue injury, but also infection. The potential for infection is of great importance. Dog bites inoculate bacteria deep into the tissue, and while not as aggressive as cat bites, many dog bites do get infected. Common bacteria involved in such infections include staph and strep. And there is some controversy regarding antibiotic therapy for dog bites. Some healthcare practitioners routinely prescribe antibiotics, while others choose to wait until the wound shows signs of potential infection. Rabies is always a concern, although very rare, and a variety of approaches may be considered by the clinician depending upon the situation surrounding the dog bite. Your doctor may choose to suture the bite laceration, and it may make the scar look better, but it does increase the risk of infection. Balancing the risk of infection against the benefit of a better-looking scar depends upon the location of the injury and the discussion between healthcare practitioner and the patient. Dog bites to the face tend to be sutured, while those located on less noticeable parts of the body may be left to heal on their own. Prevention is really the most effective way to deal with dog bites, so you and your family should stay away from all stray dogs. I'm medical editor Dr. Corey Hebert with your Weekend House Call.